Fibromyalgia is a chronic condition. It has been found to affect more and more people in the recent years. The main complaint a patient would report is the pain, long-term pain, which lasts for more than few months. The pain tends to affect various parts of the body simultaneously, or can affect various groups of the body on separate occasions. Pain can be aggravated and can settle down to some extent, but it's a more of other symptoms as well, which gives fibromyalgia the different presentation of chronic pain. Patients tend to report tiredness, fatigue, the lack of sleep, and also non-refreshing sleep. There can be also muscle stiffness. They can be accompanied with headaches and various other both physical and mental and cognitive consequences. We found many patients suffering from anxiety and also from depression. Some patients report abdominal and pelvic pain. Other patients reported painful and heavier periods. The fibromyalgia is a chronic condition, and that can affect the quality of life as well as giving the patient the unpleasant experience of pain. Because of the presentation of fibromyalgia can vary from one person to another, it tends to affect women much more than men, and also they are commoner in patients who are between the age of 30 to 50 years old. Still, it can be found on very young group of patients and also in patients 60 years and above. Due to the varieties of symptoms patients would report, the impact on quality of life can differ. Some patients would have more problems with the level of pain itself. Other patients may find the anxiety and the sleep disturbance are the main issues. More patients are complaining of headaches, which can be quite limiting in terms of their day-to-day activities and ability to perform and function. Other patients report what we describe in medicine as cognitive impairment, with effects on memory and also on the speech, and sometimes what they describe as fibro fog. So the impact of quality of life of patients with fibromyalgia can vary a lot based on what are the main sets of symptoms can affect them. Saying that, we have noticed that patients with fibromyalgia tend to have less ability to physically perform exercises, and also can have issues with the sleep disturbance in a way that their functional performance the following day can be seriously affected because of the lack of sleep. Patients also described dizziness. More patients also describe abdominal pain. So the impact on quality of life in fibromyalgia patient is one of our serious concerns at the pain clinic, whereby we aim to improve the quality of life and help the patients to manage their pain and be able to maximize their performance and still enjoy decent quality of life. So fibromyalgia is a condition that it's best to be described as manageable. And the main aim of manageable condition is to see what the patient would require and what actually is the main concern for patients. As we mentioned, there are many implications of fibromyalgia and impact of the fibromyalgia on the day-to-day performance of the patient. For that, what we do in the pain clinic is we see the patient and we have a discussion with them about their main concerns. We aim to address the pain as well as aim to address the impact of pain on the quality of life. starting with what concerns the patient most. It can be their sleep disturbance. It can be the lack of ability to enjoy exercises and sports. It can be what we describe the cognitive impairment, or their lack of ability to focus or concentrate, and also the memory issues. So we see the patient and have thorough discussion with them and to assess their individual need. And based on that, we'll be able to give them their own individual plan. The plan would require more than input from one member of the team. And that's what we do actually at the pain clinic, is that we address the individual patient concern. There can be many options that would help reducing the intensity of pain and also help the patient improve their quality of life and enjoy the pleasure of activities which they stopped enjoying for some time because of the fibromyalgia and the constant pain. Medications have been found to be useful when they are used in the right way. There are varieties of medications which can help people managing their pain, improve the sleep, as well as reduce the muscle stiffness. Sets of exercise can also help the patient. We encourage them to stay active. We encourage them to consider pacing their activities, do some swimming exercises, aerobic exercises, walking, and also low impact exercise. So activities and managing the pain and self-management is something that we can advise the patient with, and we give them thorough explanation for it. More options is to consider factors that would help improvement on sleep disturbance. In terms of medications, some medications can help with the sleep disturbance as well as with the intensity of pain. We have seen patients responding very well to courses of antidepressants. And these antidepressants are not necessarily to treat depression. They have been found that they would help with the pain control. So they can work as a painkiller as well as sleeping improvement. And these medications, while they can help the pain, they can cause the patient some side effects. And one of the points we would discuss with the patient is to address the risk versus benefits of using these medications. Also, acupuncture have been found useful in some of these cases when patients noticed improved in the quality of their sleep and also reduction of their muscle stiffness. Massage and deep tissue massage and topical heat application have been found to be helpful as well. Hydrotherapy has been found useful for patients with fibromyalgia. We have also noticed that using the TENS machine has been helping patients with long-term pain condition. The best approach I would recommend for patients is to have a consultation with the pain clinician who can actually address the patient need and can tailor an individual management plan for patients with fibromyalgia. We do encourage patients with fibromyalgia to exercise regularly. And the key behind exercise is to pace their activities. So slowly increase their level of exercise. We do recommend that they perform gentle exercise, low impact exercise, such as swimming or walking. Also, some exercises of muscle strengthening can be useful for a particular group of patients. However, we have to be careful about which exercises group would fit that particular patients. And this would be helped by seeing a medical consultant or by seeing physiotherapist. We also encourage the patient to consider psychological interventions. The psychological interventions are helping patients quite significantly in a way that would help reducing the impact of pain on their quality of life, as well as helping them knowing more about relaxation techniques, stretch exercises, coping strategies, and also to gain the skills to address goal settings and have realistic goal settings. Psychological intervention is something which is important in helping patients with fibromyalgia. And in the pain clinic, we do have psychological input that would help the patient to have the psychology under the umbrella of multidisciplinary approach. And that includes the physical therapy, medical therapy, as well as the psychological therapy. So timing these treatments together and joining them within the right set of time would provide the patient to the best care and would help them improving their condition and also improving their quality of life. And that also would help them reducing the intake of medications and in the same time targeting the muscle stiffness and improving their both physical and their mental abilities. I have a number of patients who actually benefited very significantly from our approach at the pain clinic and under my care. Patients have benefited by knowing the nature of fibromyalgia, and it is important that patient would ask their clinician about the disease process and about the symptoms and why they're happening. It is important for the patient to start self-management, that they understand the condition they are suffering from. And that would help patient reduce the element of an anxiety and also reduce the depression. I have seen patients under my care who actually managed to significantly increase their level of exercise. They managed to lose weight. They managed to reduce the painkillers that they were on, and good proportion of them managed to completely stop all their painkillers because they have noticed significant improvement in their condition as well as in their quality of life that stopped them requiring these medications. And as we mentioned, the medications, while they can help the pain, they can cause patient side effects. Patients who had access to multidisciplinary team led by the pain consultant had the benefit of the combination of these treatments. As a result, their quality of life has significantly improved. The fibromyalgia is a condition which can be put under control, knowing that the patient is fully informed and they are receiving good quality care. The importance of educating the patient and educating the staff and having clear communication under the umbrella of the pain clinic helps achieving the patient goals and also improve their condition.